welcome back to the Digital Health Summit studio. I'm Laura Mitchell reporting to you live from CES 2016. And I have a guest with me today. His name is Dr. Scott Smith from NASA. And he is a NASA nutritionist, lead for the Nutritional Biochemistry Laboratory. That's a long one for the business card at the Johnson Space Center. So welcome to the show. Thanks for coming.
My pleasure.
Tell me a little bit about what, when you think of NASA, the first thing that comes to mind is not always nutrition. So tell us about that.
Well, I would say I'm a rocket scientist in the very loosest sense of the word. And yeah, indeed, I'm a nutritionist. And I lead what's called the Nutritional Biochemistry Lab, and our group is targeted at trying to understand the body's need for nutrition on exploration missions, on long-duration space station missions, on our way to other planets. Trying to figure out what people need to eat. If you go back
that's critical.
Amen. And if you go back through history, you look at things like sailors that got scurvy, it's because they didn't have vitamin C.
Sure.
We need to avoid that exact same thing. And trying to understand how we can use nutrition to help keep people healthy, to help mitigate some of the diseases and negative effects on the body, things like bone loss and muscle loss and vision changes. Nutrition plays a lot in those responses.
Someone's got to be thinking of that.
Indeed, indeed.
So you released a paper this week. Tell us about that.
Well, this is a big deal for us. And what we published this week is a paper showing that there's a relationship between nutrition and genetics in people that develop vision issues during space flight. Vision issues are something that jumped up in the last 5 or 6 years. We didn't realize that was a health problem in space flight. And it is now one of our top, if not the top health concern for astronauts.
Well, yeah, wow.
The simple way to think about it is that we have people going up with perfect vision that come back 6 months later and need glasses.
Right,
It's a little more convoluted than that, but that's the gist of it. What we've shown is that a subset of those people that get these vision issues may be genetically predisposed to it.
Okay, and then something's triggered.
Right, and we don't know what that trigger is, but if we know who to study, that helps us out. One of the interesting spin-offs of this, in looking at the scientific literature, we found a clinical population that in many ways matches what we found in the astronauts. Okay, so blood levels of chemistry, blood levels of hormones, lots of different things that are the same between affected astronauts and women with polycystic ovary syndrome, which is the leading cause of infertility in women.
Right.
And what we maintain may be a way that not only can what we learn about astronauts help people on Earth, but we may be able to study people on Earth to help us solve problems for both populations.
Very cool.
The spin-off of those things is profound. We're here at CES to participate in this panel this morning with the Square Roots folks. Their focus is on maternal and child health, and nothing is more important than nutrition when you look at maternal development, pregnancy, child health, pregnancy outcomes, and trying to shine a light on those things is one more way that we can spin off.
Excellent. So how do we find out about NASA? Where do we go to find out about what you're doing?
NASA.gov is probably the first starting point. I mean, that's NASA's main page, and everything drills down from there.
Gotcha.
And if you look there on the space station webpage, there's a link to our study and a link to all the other research that's going on, a link to spin-offs from the space program, both technological as well as scientific.
Sounds great. Well, thank you so much for joining us, Dr. Scott Smith from NASA. This is Laura Mitchell reporting to you live from the Digital Health Summit studio at CES 2016.